Hello, welcome to this episode. Sean Brewster with you once again. Today we are talking about selling the wrong thing. This is a mistake that I see quite a bit in the healthcare industry with regards to how practitioners market themselves to the general public. There's a general misconception that the wrong things matter. And by the wrong things, I'm talking about title, as in your qualification, and I'm talking about skills. Now, it's interesting that so many of us work so hard to get our qualifications, and rightly so. That is our ticket to get in the door to do what we do. And we work really, really hard on the skills to acquire those and develop those and get the best that we can at those things. And rightly so, because we want to be able to do a good job with our patients. But here's the interesting fact. Patients don't really care about your qualification, and they don't really care about the skills that you have. Have a guess what they are interested in? That's right, themselves. They are interested in the outcomes that they are chasing, the results that they want to achieve. And so their interests are kind of divorced from ours in a lot of ways. And the mistake that we make, or the mistake that anybody makes when they go to present themselves or market themselves to the world, is to focus on the things that they, the person doing the marketing, believes to be true, or believes to be important, I should say, rather than the things that the consumer, in this case the patient or the client, would see to be as most important. So we have to change our mindset. We have to change the way that we're viewing what we're doing and why we're doing it. If we put ourselves in the shoes of the patient, the consumer, the client, we would have a problem we need solving. And realistically, that's the most important thing for them. They're not coming to see you for the experience in most parts. They're not coming to see you because they like hanging out with you. Or maybe they will, but not initially. Initially, they don't know you. They need a reason to choose you, to come and see you, to get the solution that they're looking for. So the reason they're coming to see you is because they have a problem that needs solving. Now, if we present ourselves as, let's just say I'm a physiotherapist and I specialize in treating neck pain, and I'm really good at joint manipulation, and that's what I'm going to focus on. So I present myself as a physiotherapist with a special interest in neck pain, with a manipulative manual therapy approach. Okay, great. So if you're talking to other health practitioners in the manual therapy field, they're going to know exactly what that is, but the general public don't know, and even more importantly, they don't care. They have a pain. If they have neck pain, then the things that we should be presenting to them are the types of problems that we solve. Okay, so if we drill down a little bit deeper into this and we think about where we market ourselves, where we promote ourselves, the first point of call might be our website. It might be on our social media. It might be in paid listings on digital or print media. It might be on signage on the front of your clinic. All of these things are where people will observe us, see us for the first time and go, this guy, this girl might have the thing that I'm looking for. So the thing that they're looking for, again, is a solution. So all of our marketing, all of our media should be geared towards delivering information about providing answers or solutions to their problems. And so rather than highlighting, focusing, just basically putting all your attention into talking about your qualification, what it is that you are titled as, and the types of tools that you might use along the way, I think it's far better to focus on the kinds of solutions that you provide. So on the front of your clinic window, if you have a brick and mortar type setup, and if you've got a clinic space with a window that advertises what you do, ideally that's where we're going to list the kinds of problems that we solve. So there you might list things like sports injury treatment. You might look at like acute injury rehabilitation. It might be pre-surgical management. It might be headache. It might be neck pain. You can list all the things that you might be really good at. And then when somebody sees that, they go, that's exactly what I'm looking for. They don't know if they need dry needling. They typically don't know if they need joint mobilization or manipulation. They don't know if they need taping. They don't know if they need an exercise intervention. They don't know if they need deep tissue massage. They don't know if they need anything. For the most part, we have to assume that they don't know what they need. All they know is what they want, and it's a solution for their problem. That's usually a reduction in pain or an improvement in function. So our job is to figure out what we're really good at, to figure out how to present that to the world in a way that would be attractive to the consumer. So this means stepping back out of our own egos and, yes, looking at all the skills and knowledge that we have, but thinking about how that relates to the patient, not how it relates to the things we do. If you're walking down the street and you see a fast food shop, they're not going to be advertising or highlighting or focusing on how they cook the food, the tools they use, the instruments they use, It's not the idea. What they're trying to do is capture your attention by providing a solution to your problem, which is hunger, or it might be a particular taste that they're looking for. So they're going to advertise what I like to refer to as the sizzle rather than the sausage. So if the focus is going to be on providing solutions in our marketing in the way that we present ourselves, and we're going to go down the path of listing things that we can solve or problems that we can help with, there's also a danger in that, a potential danger, which is providing too much for people to focus on. And I've seen this happen in real life. I once drove past a health practice, a manual therapy clinic, and on the front window it said, "We specialize in headache, neck pain, shoulder pain, upper back pain, lower back pain, pelvic pain, hip pain, knee pain, ankle pain, foot pain, plantar fasciitis, sciatic nerve pain," and the list just went on and on and on through every possible thing you can think of until the window was completely full. So in other words, they don't specialize in any of those things. They can treat possibly all of those things, but they're not really focusing on any one thing. And so when we present ourselves, we have to present the thing that we think we can do the best work with. And you might think, well, that cuts off part of the market. I disagree with that. I did a podcast recently about developing and implementing a niche in your business. I think if you're at all worried about that, then I'd go back and listen to that one because it addresses that topic in particular. But know what you're really good at. Be confident in that and be willing to tell people, this is the thing, or these are the few things that I do really well. If you're looking for a solution, I can provide answers for you. I can provide that solution. If you were to list everything that you can do, you're essentially telling people you're a generalist or you don't really know what you're good at. And we all know that people will pay more for a specialist. They will line up for a specialist. They will wait to see a specialist. And they will refer to a specialist. So if you're really good at treating headaches and neck pain, then tell people that. If you're not bad at treating hip pain and pelvic pain and knee pain, well, then maybe just focus on the neck and the headache. Maybe you can do marketing in another place and advertise your work that you do with hip pains and pelvic pain and so on. So you don't have to tell everybody everything all at once. The way you present yourself should be succinct, should be clear, and it should be focused on the patient, their needs, the solutions they're looking for. And we need to step back from that ego, step back from the things that we've worked so hard to attain, such as our qualifications and our skills, and recognize that they are the tools that we use to provide solutions for our clientele. And they don't care about those tools, they just care about the solutions. Hopefully this has been helpful.